Okay. So we'll catch people as they come on. I apologize for not sending the agenda out, but I have it. So our last steering committee call was February 13th, which was last week, Monday. And that was myself, Lisa Johnson, Keith Chartier from our QIO here in Phoenix, and Shelley Zilstra was on the call. And so we kind of came up with an agenda, so I'm just going to follow that, even though I think I sent out the steering committee minutes. I'm pretty sure I did. All right, so we're going to start by, let me just look here, introduction. So if everyone could just please introduce yourself again and remind everyone what you do. I'm Debbie Dijak. I'm the education coordinator. I'm out at Archie Hendricks in Arizona.
Hi, this is Melissa Heflin. I am the Elder Program Manager at the Alaska Native Tribal Health Consortium.
I'm Julie Cahoon with Kaufman and Associates. We contract with CMS and do work to support the Nursing Home Collaborative, U.N.I.T.E.
Good.
I'm Hannah Stacker. I'm from the University of Arizona. I'm the program coordinator for the Geriatrics Workforce Enhancement Program that is helped to fund the national or the yearly meeting and is involved in the calls as well.
Hi, this is Teresa Holt. I'm the State Long-Term Care Ombudsman in Alaska.
Thank you, Teresa. Val, are you still there?
I'm here.
Oh, go ahead and introduce yourself.
Yeah, I'm sorry. Val Crail, the administrator at the U.N.I.T.E Nursing Home here in Kotzebue.
Good. You just told me they had 49 inches of snow.
Oh, no, 49.
Oh, God, is it 49? It's like, wow.
No, 49 is snow.
49 inches, but 40-mile-an-hour winds, so that really sounds...
The winds are correct. It's just 49 inches of snow.
Oh. All righty. So, Val, did anyone else join the call?
Joseph Ray.
Joseph, oh, great. Can you just introduce yourself again, Joseph, where you're from?
Joseph Ray, Laguna Rainbow Center board member, Laguna, New Mexico.
Excellent. Anybody else on the call that we missed? Okay, I have Val, Julie, Hannah, Debbie, Teresa, Melissa, and Joseph. And Melissa is muted, just so you know. So I'm just following the little agenda that the subcommittee came up with. So our next thing is the administrator report. So Val, since you're the only administrator on the call, I'm going to go ahead and let you give us any updates that are happening in your part of the world.
Okay. The main project we're still working on is one of the traditional foods up here is seal oil. We had an initial report, clinical, in terms of lab results. So far, so good. March 17th, we'll be doing a follow-up final call, if you will, and we'll include the state of Alaska on the call, the regulators.
Okay.
And looking at, have we done everything that we need to assure safety of food? So what we have to do is make sure we have a HACCP plan that's got all the lab results. They're testing for water content, this, that, the other, and then if this works, it'll then affect, or at least we're hoping to get a roadmap for the other facilities across the state to be able to serve this particular traditional food and go from there. So that's been kind of a 2-year project for us.
I was going to say, how long have you been at this?
It's been a while because you're also part of the project's dictated by the seal hunting season.
Oh, okay.
So it's not just, I mean, they have actually 2 seasons of hunting here. One is in the spring, and the way they make seal oil here is a traditional method, which is out on the by the shore. It's a solik, if you will. That the state of Alaska will not accept as being an approved food source, if you will. It has to be in a building that has a state permit on it. So that then defers it to the fall seal hunting season.
Okay.
So we've had to wait till the fall hunting season to do that. They've done tests for botulism, for water content, which is where botulism grows.
Okay.
And just finding researchers that are even able to do this has just been an adventure, because when you get into doing traditional foods, one of the challenges is if you test for botulism, you have to have the CDC out of Atlanta involved. So we're getting into areas we never thought we would.
Right. And weren't you working with a researcher out of, was it Madison?
Yeah, we're working with a researcher who gets his chemicals from the CDC, but it's a lab that very fortunate that the professor was willing to do this for gratis. Because a lot of times when the researchers do work, it's not so much where they can do something that's cultural or has a real world implication. And I hope that I'm trying to make that sound right, where it actually has an effect on people. And this one, because they thought it was so unusual, they said, we'll do this project for free if you fly us up to Alaska.
Right. Well, it really is. It really is unique and unusual. I would agree with that.
Well, I mean, for us, go ahead.
No, you go ahead.
I'm saying from a cost point for a facility, for us to fly him up, it's like $1,500. There's no way we could find a consultant at that price.
Yeah.
To begin to do this sort of thing. So it's kind of a win-win. One of the guys here, Chris Dankmeyer, who's a hospital or community health sanitarian, is looking to do a seal oil symposium for the state. And Alaska has and Melissa can comment on this, a plants and food symposium. Last year there was a 5th annual plants and food symposium, which we participated in. This year they're looking at doing regional symposiums instead of the old statewide one. So Nelik has offered to sponsor one of them. So we'll find out a little bit more on that. But,
so these regional symposiums are on traditional foods?
On traditional foods. The main focus is plants as food and medicine.
Okay.
And so Fairbanks is looking to do one in their region. We just got off a conference call a couple of days ago to see about sponsoring one. And then I think Southeast Alaska, other facilities interested in doing it first.
Make sure, excuse me, now, whoever's on the call, we're getting a lot of background noise. Make sure you're muting if you're going to be making a lot of noise, okay? All right, go ahead, Val.
Sorry. So it's an opportunity for facilities across the state to talk about plants or foods that affect their diets or culture, more local, if you will. And so we're looking at that as well. So it'll be interesting to see. But we'll be talking about looking to partner. I think for us, and a facility up in Barrow is very progressive on plants. So we'll probably talk with them.
Okay.
So that's the main focus.
Would some of the tribal elders be attending the symposium?
Well, absolutely, because what we'd like to do is have them talk about, share some of their backgrounds, their culture, and their diets here. We got CMS to agree to accept that the tundra is our garden, which was just amazing.
Yeah.
So all the
What?
pipes on the tundra now, technically, we can serve it through the kitchen.
Right. That was a pretty amazing breakthrough.
I was surprised that they accepted that. I thought that for sure they would throw that out.
So one thing, does anyone have any questions for Val? Or Val, was there anything else that you wanted to talk about on your administrator report?
No, that's the main thing happening here. And so a lot of things in flux. Probably by the next U.N.I.T.E meeting, we'll have kind of a wrap-up onto the COO where that stands, and then some more information about the regional presentations, and go from there.
Okay, good. That's excellent. Anyone have any questions for Val? Okay, so I want to remind everyone that on CMS.gov, if you go to Outreach and Education, and then American Indian, Alaska Natives, and then you'll see our website, you realize that our paper that we wrote last year on traditional foods is now housed on that website. And so, please use that. Please print it out and give it to all your departments and let them know the work that U.N.I.T.E is doing, and also just things that are out there in terms of, new regulations. So consistent with what we found and what we put into our best practice paper, there was a webinar last week with the Pioneer Network. I don't know, some of you may have saw it, on dealing with the new mega rule with CMS and what they mean for culture change. And they specifically there's 2 pages that address food and nutrition. That's 483.60 for CMS. It says text remains to provide well-balanced diet, but now adds taking account of resident preferences. So that is now in the FTAG. Menus should reflect religious, cultural, ethnic needs of the population and input from residents, which is exactly what Val was talking about. Adds, nothing in this section should be construed to restrict residents' right to make personal dietary choices. The other thing that's in the new mega rule that they pointed out, CMS has actually added this to the regs. The home can purchase food from local producers, so that's good. Home can have its own garden and use the produce on the menu. Residents can eat food not from the nursing home, like if they want to order out. And residents can eat food brought by visitors, and home must provide safe storage and use, and that would include leftovers. So there's some really, positive CMS regulatory changes that are consistent, completely consistent with what Val is doing and what we've been talking about. So, anyone have any comments on that? Because that is an agenda item. We're going to start talking just really briefly on each of our calls on how people are doing with the work on traditional foods. So does anyone else have something that in the last 30 days they've done with traditional foods in their facility?
Hey, Debbie, this is Melissa.
Yep, go ahead.
Hi. So, the Alaska Native Tribal Health Consortium, we don't actually have a facility, but we work with other organizations in trying to meet the need of our Alaska Native elders who inquire about traditional foods. So
right.
within the last month, we've worked with I think it's a for-profit hospital. So it's a non-native hospital where it's the stroke rehabilitation section of their hospital, and so they have like 10 beds. Out of those 10 beds, 5 or 6 of those beds are filled by Alaska Natives. And
wow.
There was a request that was sent to us to my program to find out, can we provide some kind of traditional foods, because the stroke rehab patients, they're not eating. And so if they don't eat, they're not going to get strong enough to go go through physical therapy and then be discharged back to their communities. So we've been working with that hospital in providing, that component of traditional food.
Awesome. Are you taking in like some kind of, like, are you making food and then bringing it to them? Is that how you're addressing that, just to get it going?
Yeah,
what are you doing?
So we take it from the perspective of the activity.
Okay.
The patient, or just like we're doing with the nursing homes here in Anchorage, is if an elder or native patient or elder, decide to participate in this luncheon, they can. It's not, and so if they choose not to, then they're still provided the option of, tilapia, potatoes, and asparagus for their lunch, if that's what the facility is providing. So we take it from the perspective of an activity, and we've had a lot of participation. So, like I said, we have our luncheon today at the Prestige Nursing Home, where I just got to making some salmon stew. We're also going to have just black-tailed deer that has been ground up. So we're going to have like meat, rice, and gravy, and fry bread and Eskimo ice cream. We also will have herring eggs and a little bit of bowhead mukta as our menu choices for today.
And in what kitchen is that being prepared?
So these, we actually prepare them in our own kitchen, and then we bring them to, as like I said, it's almost like a potluck concept.
Okay. Mhm. Okay. Yeah. Perfect. All right. Anyone else have anything in the last 30 days? Our traditional food committee is meeting, but I'll tell you what, it's hard getting everyone together and on board. So I just keep telling them, like, it's okay to do this stuff. Like, we can make some progress in this area. I mean, I feel like we have all the regulations at this point on our side. It's just a matter of knowing what the residents want and doing it in a safe way. Would you agree with that, Melissa? Or I forget, she keeps muting.
Yeah, sorry, I'm muted and
Sorry,
so
I forgot.
So that I'm driving back to my office, so I'm connected to my vehicle. But yeah, I would totally agree with you, Debbie, that if we've already got all the groundwork laid out for us, so let's just keep moving forward and meeting the need of our people.
Right. So those would be probably, folks, your biggest concern right now would be the what do residents want piece, and then the safety piece. And Val, you're available as kind of a support for any tribal nursing home out there that's trying to make changes, right? I mean, you'd be happy to conference call or talk to their staff or anything like that, right, as an expert here?
Not a problem. Anything I can do to help, I will.
Okay, so please use Val as an expert because he is, and he's done it. And if you can't get something through at your facility, Val is an administrator. He can definitely talk to your administrator and kind of step through some of this, and he's very aware of this. Okay, so thank you all for that. The next thing is the KAI. So go ahead, Julie. Can I give us some updates?
Hi, Debbie. Thanks for letting me provide an update to everyone. So we are in the progress of developing a best practices report on nursing homes. This is part of a quarterly series that CMS is putting on, and KI is helping to develop. And we were working with Debbie and the U.N.I.T.E group to kind of put the pieces together and the topics. So this topic is dementia care in tribal nursing homes. So we have some background information on Alzheimer's and the Alzheimer's disease and dementia in Indian country. And then we have information about a tribal nursing home survey that is in development. And so the report will essentially focus on those two areas. And we've and I'll just reiterate what the plan is for the year for these best practices report is to kind of cohesively develop and report out on the progress that tribal nursing homes are making towards dementia care in their facilities. So the next best practices report, which will come out in, I believe, in the summer, will focus on tribal leaders and how tribal nursing homes can communicate with their tribal leaders about implementing dementia care needs in their facilities and getting the support and resources needed to do that. And then the last report of the year will focus on an overview of all the progress that has been made throughout the year.
Right. So, Julie, what I have from our January minutes, I was going over our minutes from our January, and she's right. So remember, everyone, we decided at our dinner meeting in November to have a kind of a clinical topic for the year and a non-clinical topic. So the clinical topic has to do with dementia care, and the non-clinical one has to do with this relationship between boards or whoever your governing authority is. So those are our two kind of topics for the year. So is the first one on dementia care is coming out March 1st, correct?
Yes, that's correct.
Okay, so it's March 1st, I believe June 1st, September, and then December. So Julie is in charge of that. And Julie, when are our webinars scheduled? They're June and July, right?
That's correct. June and July are the webinars, the fourth Wednesday of each month.
Okay, so the reason it's really important, folks, that we make progress on this and do our surveys and gather information and have these conversations on our monthly meetings is so that we have something to present, that we as a tribal nursing collaborative can come out and say, hey, this is what we think, we want to be able to share that on these webinars in June and July. Okay, so anything else, Julie?
At this point, that's all that I have, Debbie. I know that we're, rounding the corner here on the development of the report. Once I get your input or the information that you have, Debbie, we'll incorporate that into what we have so far, and then it'll just be in review, and then we'll submit to CMS, and then from there, It will probably just be about a month before it goes on the website.
Okay, so you don't think it'll actually show up there till what? What's your best guess?
My best guess, honestly, would probably be the end of March.
Okay, the end of March. Okay, and I apologize for not getting it to you sooner, but that's just my fault. So are the meeting transcripts, Julie, I have not seen those. Are those supposed to be on the CMS.gov website for these calls? I thought they were being recorded.
Yes, all of the calls are being recorded and transcripts are being made. It's just the process for developing the transcripts is rather lengthy. And then as far as uploading them to the website, there's also an internal process and a CMS process in place that does take some time.
Okay, that's fine. I just wondered.
Okay.
Yeah, that's fine. I just wondered. Okay, so then any information, well, before we get to the QIO report, if there is one, I wanted to, those of you who weren't on the January call, Rebecca Drummond, who is the grant person here for the Tohono O'odham Nation, she spoke, and we did submit her the grant. If we do get it, if it's awarded, it'll start June 1st. We probably won't hear till May. And so this is a planning grant, so it would be a 1 year, I believe it's $100,000, and this would help us as a collaborative to really get off the ground. So there was an MOU that was signed by Morningstar and also by Cotton View, by South Group, and then by us here at Archie Hendricks. And just so you know, there's some pieces of this. It's again a planning grant to establish kind of vision and mission. We did get some outside support from the Aglala tribe, the State Office of Rural Health, Dr. Blythe Winchester, and the University of Arizona. Hannah, do you remember signing something or sending a letter of support to Rebecca Drummond?
Yeah, we did.
Good, excellent.
Mm-hmm.
Excellent. So we've got some good support, and if we get it, I think we'll be able to work, really work on this collaborative. And if the planning grant is awarded, we could actually apply for a development grant which could be used, 30% of that money could be used for direct services. So we could actually really implement some changes, which would be really awesome. So keep that in mind. We have not heard anything. Like I said, we'll probably hear in May. Okay? And QIO, is Keith on the call or Lisa? Okay. I know Lisa said there might be a problem, so if they do get on the call later, we'll try to leave a little time for them. I'm typing minutes as we go, so you'll have to excuse me. So the next thing on the agenda, in case you weren't on January's call, we had Don Thibodeau from Alaska speak, so I wanted to thank him for doing that. There were a couple little, when I looked over the minutes, I realized I'd forgot to do a couple things. Joseph, I will let John Johns know from CMS about putting you on the TTAG call because I didn't have a chance to do that. I hadn't done that yet. Just update, to just remind you what Julie was just saying, when the subcommittee met on the 13th of February, we came up with some questions for that SurveyMonkey. Lisa followed up. She sent it out. We gave her some feedback as to what we thought was good or bad. She did a great job on the survey, and it was sent out yesterday to all the administrators. So if you're an administrator on the call, you should have got that. She did email me this morning and said she heard from Wayne Claw up on the Navajo Nation in northern Arizona. So I was really pleased that Wayne responded. We tried not to be too overly extensive. But we do need some feedback on these two issues, our clinical and non-clinical issue. So that survey was done and it was sent out to all the administrators. Okay. That's more of an internal one. The other, Dawn, are you on the call by any chance? Dawn Thibodeau or Lisa? Okay. There's some work going on in Alaska with a dementia survey. And I believe that's going to be sent out to all the nursing homes in Alaska. It will probably be sent out to everyone on this collaborative, too. Melissa, I'm sorry, I know you're muted, but do you have any idea when that might be coming out?
I am not sure when that's going to be sent out.
Okay. All right. I think it's probably sooner than later, so we'll try to give you a heads up on that, okay? And then, Hannah, why don't you give us a little GWEP update? Because I don't think, you're not always on the call. So why don't you give us a little update on the GWEP?
So as far as the GWEP goes, we're, Dr. Fain and Dr. O'Neill, my supervisors, are really interested in continuing to support the annual meeting as much as we can, and also participating in the calls and learning any best practices that can be used in other strategies to connect not only tribal nursing homes but other, tribal health institutions. And I think that's where we are at right now. Thanks.
Okay. So in case you are still unfamiliar, the GWEP is the Geriatric Workforce Enhancement Program. Hannah, how many are there around the country? There's like 300 grantees or something?
No, there's not as many actually. I think there's only about 40. There's less.
Oh.
There used to be more GECs. There's less GWEPs. And it's a prestigious HRSA grant that we have for 3 years. And the purpose of the grant is to integrate geriatrics into primary care. So we're not usually necessarily involved in nursing home care, but we're really excited about being involved in U.N.I.T.E and learning about connecting because it's such a unique collaborative, connecting tribal health institutions across the country, that we're really happy that we can support it. And we are funded through fiscal year 2018, and then we will reapply for the grant as well again.
Very good. So through to 2018. So part of my position out here at Archie Hendricks is actually funded through the grant. So that's why how I got connected with the Geriatric Workforce Enhancement Program that's going on at the University of Arizona in Tucson. It used to be called the GEC, which is the Geriatric Education Centers, but they're not called that anymore. So if you want to Google that, you'll get some more information. You can Google GEC or GWEP. So thank you, Hannah, for that information. I wanted to also, Teresa, I'd like to ask you a question. I know you're the ombudsman in Alaska. When we had our steering committee call, this is just some old business, Shelley Zylstra mentioned in her office, she works with a Louise Ryan at Administration for Community Living, and she said something about they had an ombudsman contact, a tribal liaison. Do you know who that would be? Because ombudsmen are certainly welcome on this collaborative. Do you have any thoughts on opening that up a little bit?
I don't know who that would be. No idea.
Okay.
I could email Louise, though, and ask.
Yeah. Would you mind following up? Because I'm just so far behind. I could use a little help here. And also, the steering committee...
Tribal liaison for long-term care ombudsman?
Yeah, I guess, I'm delighted you're on the call. I'm wondering if there's anyone else, someone like at Shelley Zylstra's level position, ombudsman-wise, that would like to maybe be on the call. I don't want them to think they're not welcome. You know what I mean? Like we have talked about this for a while.
Yeah, I think that would be Louise. There's only 2.
Okay.
Total.
Can you just refresh us real quick how the ombudsman works, like across the country, how that works, the structure of it?
Right. So every state has an ombudsman program. Basically, they were set up to run with volunteers. And the idea would be that every facility, and it started out focused on nursing facilities, but every facility would have a visit. The standard is every quarter, at least one quarter. Okay. And the job of the ombudsman is to talk with the residents and then resolve any issues that the resident has. And there is a specification that it be to the resident's satisfaction.
Okay.
And so it's really interesting. If a resident has significant diabetes and she wants to eat cake every night, that's what we have to argue for.
Okay.
But it also does the whole gamut. We do some situations where people have been abused or, assaulted or whatever. All kinds of stuff come up. And I want to say 5 years ago it expanded. And now we're allowed to do the same services in assisted living homes. So some states do that. Some states do only nursing homes. But there is at least one state ombudsman in every state. And then some states are big, like California, New York, Minnesota. There's a bunch of states that have a lot of populations and a lot of nursing homes. And so they will have what they call local ombudsman or regional ombudsman.
Okay. But they're always volunteers, right?
No, it varies. The idea would be that there would be volunteers. So in Alaska, for example, we're one of those small states. There are 6 paid ombudsmen and 30 volunteers.
Okay.
And some states have chosen to not have any volunteers. So it's a kind of a grassroots kind of thing. And each state is different.
Okay.
This is Joseph.
Go ahead.
May I make a comment?
Absolutely.
I'd like to ask the ombudsman, in Alaska, is there any movement by your state legislature to kind of limit some of your work? Specifically here in New Mexico, we have a bill in our state legislature right now that seeks to prohibit the long-term care ombudsman from referring suspected cases of abuse or neglect to APS without the consent from the resident or the resident's decision maker. And I'm just wondering if that's a movement across the U.S.
That is actually, I don't know what's going on in New Mexico, but it comes from the federal Older Americans Act.
Right.
And it's really an unusual concept to think about. But the best way to think about it is our job is to go in and build relationships with residents. And so when they tell us stuff, our directive from the federal government is that we only work on issues that the resident asks us to work on. So we've had situations, I know, here in Alaska, not in a nursing home, but in an assisted living home, where the residents were terrified to speak to us because they were going to be punished afterwards. And so we are not allowed to report if somebody says, yeah, that nurse's aide is, pinching me every time she comes in the room just to get back at me because I did something. We can't report that unless the resident gives us permission.
Wow.
So it's a weird place to be in, and so there was new regulations that came out, federal regulations that came out, and each state ombudsman program was reviewed to see if their state statutes matched the regulations. And so many states, and I'm guessing that's what's happening in New Mexico, have had to go before the state legislature to change their state statutes to match the federal regulations.
Okay.
Okay.
That's exactly what I was thinking, too. It sounds like your state is catching up with, being current and consistent with federal is what that sounds like.
Well, here in New Mexico, I know that we have very few, I think 3 facilities that are tribal run, and here at our facility at Laguna, we do have a person, our ombudsman, and at times she's been a little overzealous in reporting, and and I think that instance did come up in our facility where, she wasn't directed by the resident to report some things, and she kind of got in trouble for that. So, but I don't know how widespread that might be as far as with any other centers here in New Mexico. But
right, you could imagine if you're the person who they told it to, it's really hard not to say anything.
I worked at the nursing home. Excuse me, I'm sorry. I worked at the nursing home and social services. So daily, I had to make decisions about how do I report to the ombudsman, or do I bring in the ombudsman on this one? And it's really a sensitive issue, as you said. Some of our tribal members, falsely believe that if they report things, they'll get kicked out of the facility. And I had times we had to, reassure the folks that wasn't the case. Thank you.
Right. Yeah, it's really tough because sometimes it's just one person that somebody's picking on. And sometimes it's somebody who's just mean to everybody. Those are a little easier because usually there's safety in numbers and people feel safer. But I do want to emphasize that the ombudsman doesn't just drop that scenario. They'll go back and try to build a relationship with that individual and sort of check with everybody else in the facility to make sure something's not happening to them also. And our job isn't necessarily to turn people in, turn facilities in, but to try and resolve the issue. And so in Alaska, we work with our facilities all the time trying to figure out, what could we do to make this better versus we're going to turn you into licensing or whatever.
Right. So, Teresa, I have a question. Is there any mandatory reporting then with ombudsman? No. If you saw abuse, are you under, though, a mandate to report?
Federally, we're not supposed to report unless we have permission either from the resident or the resident's representative, when that's their legal guardian, their POA, whoever, somebody else. For people who can't make that decision themselves, there is a scenario where we could report if the person is not able to make a decision themselves. Like we can't give them informed consent because they don't have the cognitive ability to do that. In that case, whoever's in the facility has to go to the state ombudsman and explain that this person can't make that decision themselves and they have no one else to help them make that decision. And then the state ombudsman gives permission to share. So that would be the only other scenario.
Okay. And are you required by law to go in quarterly?
No, that's the national standard.
Okay.
That's like the goal. But as you can imagine, in Alaska, we have to fly to many of our facilities, and it costs us anywhere from $800 to $1,200 to get there once. And so we're also a minimum allotment state, so we don't get a lot of money to do that.
Okay. So I'm gonna move on because I want a little bit of time to talk about something else. But I appreciate everything you said. I hope that was helpful to everyone on the call, especially those of us that work in assisted living or long-term care. We have asked Cynthia LeCount and Dr. Bruce Fink, about putting our U.N.I.T.E collaborative onto the ACL and IHS websites, and we're also Shelley gave us a contact, Sandy Markwood, with Home and Community-Based Services with the N4A, the AAAs. So we're going to see about somehow connecting and maybe getting on their website too so that we have a presence there, just so y'all know. The last thing is really just talking. I'd like all of you to join in this conversation. I think it's super important on the dementia piece, even though we're going to be sending a survey out, and also on this piece of tribal nursing homes and the connection. And Joseph, you're on the call. You're a board member. So how do we connect with our governing authorities? And so I want to just read you a couple things that we talked about on our last meeting and our last steering committee meeting, some things that came up. And what I'm seeing when I went back and reviewed the minutes from our last meeting, what I see as a pattern is a lot of issues with remoteness and turnover. That seems to be a bit of an issue with care and also with the whole non-clinical piece too. And so we talked about if any of these little things, kind of topics, that you can relate to that, then feel free to speak up on it. So we did talk about we need a strong, for example, on the non-clinical track and how we relate to our governing authority, that we need a strong, educated board, that, what is the board's role and lines of responsibility, that maybe we need a board orientation. We talked about that a little bit. We talked about, is the board able to hire and fire? The strengths and weaknesses of the current board. How is your oversight structured? Who is your board chairperson? Any qualifications for being a board member? Does your staff know who board members are? Is there an orientation for the board? How does the board interact with the facility? We talked about, let me just look here. We talked about let's see, serving. For example, we talked about that some nursing homes and tribal entities are separate, and yet we all serve the same community members, and so that probably needs to be addressed in this. That our goal is coordination and delivery of care. That we need some kind of buy-in in terms of that we are all part of the same, serving the same people. Need some education on some trends, things that are happening in long-term care and home and community-based services. Let's see. I'm just kind of skating through this a little bit. So in terms of this non-clinical topic, I'd like to just hear anyone that's on the call, their thoughts on, in terms of being the best, having best practices, getting that services and the best care we possibly can. How do you how do you see that relationship working? What would be a best practice between your facility and the board? What, just comment on anything that I just mentioned or anything else. I'm just typing as you guys talk. Anyone have any thoughts on that?
This is Joseph, and I'll comment. My comment is the fact that here at Laguna, our community center is about 5 miles from our nursing home, and in the past, the two groups were together, but there was a few outspoken members of the community group that came in for their daily meals that really, I guess, the residents from the nursing home made some of these folks feel uncomfortable by their behaviors, the elder nursing home residents' behaviors, crying out and how they behave, their behavior at the dinner table. That unfortunately made some of the community members uncomfortable, and it's sad to say that. I hate to report that, but the community members having a leadership group that kind of advises the tribe on policy and where they want to see their services go, or how they want to receive their services at the community center. So they probably about 6 years ago, received some capital outlay from the state of New Mexico, and it wasn't endorsed by the tribal council. The Laguna Elders Association, which makes up the community members, which has the membership there of the community elders, I think age 55 and older, secured some capital outlay and were able to convince, through a lot of fighting and a lot of bad feelings at times, they did get a facility built, but there wasn't any operating money. And I'm sorry, I'm going off on a different tangent. I think what we really need to remind our community members is that we're all one, and we can't hide from the fact that we're aging. And yes, those behaviors at the nursing home, while sometimes I guess it's unpleasant to them, and that, to me, that's where we need to go. I believe I'd like to see some thought given to that perception in our communities, that and maybe this doesn't happen in Alaska and in your communities, but unfortunately it's happened here in mine, where my own elders discriminate against the resident nursing home residents because of their behavior. So if you could, if again, they have separate facilities, and that was their wish, and we honor that wish, but it's not very, to me, it's not very kind. See, we're not being kind to each other. We're not respecting each other. We're not respecting those nursing home residents as we should. And I think at times policy is still driven by that fear. Policy that's being embraced at the tribal council level. We just created a new entity here at Laguna, the Laguna Healthcare Corporation, and our board has yet to be invited to any of these meetings. And, that just doesn't seem right. And so that's my comment.
Wow, that's really insightful, Joseph. That's awesome. Good stuff there. Would anyone like to comment on anything he said? I mean, even if it comes from your own experience somewhere else, I'm just curious to hear, this idea of, the bad feelings that can arise. I mean, how can we as a facility maybe even mitigate some of that? You know what I mean? Like, are there things the staff can do? Like, I'm thinking if I walked in to a lunch, to the dining room and somebody's yelling and I came in to visit my mom, I mean, where are the staff to kind of come over to me and say, now that's okay, we're working with him, or, you know what I mean? Like, you kind of make it, you help that person when they come in. Is there, at some level, do the staff need to be involved in this whole process?
It's a sensitive issue. I know it's a very sensitive issue, believe me. Having a disability, being a wheelchair person who uses a wheelchair for the last 20-something years, I notice the change at times in the room when I enter, because there's a lot of caring people, and they don't understand my level of independence. I'm so fortunate that I can provide and take care of myself, but society's perception of a person who's in a wheelchair is that we're handicapped, and I guess, again, that's magnified here in the Pueblo at times, where people really do not understand all the different facets of aging and disability and what it entails, and I've always tried to, and you know me, Debbie, and many of the group members know me. I'm very confident in myself and my actions, and so but again, that after years, and I guess it goes back to maybe some of the historic of these folks maybe have experienced, but again, it really makes me uncomfortable at times when people look down their noses at the nursing home residents and say, again, yeah.
So I'm almost hearing, this is really interesting, this idea that, when you talk about being handicapped, it's like almost like nursing home residents, that they're handicapped. They have that same, and it's a perception. And Hannah, is Hannah still on the call?
Yeah.
Hannah, are you still on the call? So did you hear what Joseph Ray just said?
Yeah.
Because I'm thinking that maybe addressing, this is really good, Joseph. I think what you just said is super insightful. I don't know what anyone else thinks, but I think this whole piece of getting support, when you talk about root causes, when you talk about, joining up with other aging services on the tribe, or getting people to support the nursing home and not talk badly about it and all that kind of stuff, part of this is what you're getting to, Joseph, is this root cause of how do they perceive nursing home residents? And so there may be some discrimination here in terms of aging and disability. And I'm wondering, Hannah, if that's something that the GWEP could maybe talk on the next call a little bit about, is aging and disability and how that's perceived, and how we can maybe mitigate some of that, and open that dialogue up a little bit so it's not such a scary place. The fear that you mentioned, would that be possible? I don't know who would be appropriate. Would maybe Mindy, or I don't know who would lead that discussion.
But we have materials on ageism and stuff, and I'll bring it up at our Wednesday weekly meeting and get back to you.
Yeah. I mean, what do you guys think? Who I don't know who's all still on the call, but what does the collaborative think about that as a possible, almost like a root cause that needs to be addressed so we can move forward with some of these relationships? And move forward in a really positive, non-fearful type of way. What do you guys think?
Debbie, can you repeat it? I'm so sorry, I got distracted.
So do we need to deal with some of the things that Joseph was talking about, some of the fear, maybe some of the ageism or discrimination or anything that nursing home residents are kind of seen as, being, handicapped in some way? And how do we, maybe that's a kind of a root cause issue that needs to be looked at so that then the nursing home is more, it's not such a scary place. It can be supported. We're not off on our own doing whatever nursing homes do, but we're part of this bigger picture of geriatric care. It's more seen like a continuum and not like, oh, the scariest place on earth to go is this nursing home.
I mean, that's going to be a challenge. And I think in terms of how you relate who we are to the other players in the continuum.
Mm-hmm.
I think, I guess the question is, are we looking internally or are we looking out to the public? Are we looking at public perception or are we looking at internal perception?
Well, I mean, he talked about community. I'm thinking community within the nation. You know what I mean? Like, what is the perception, maybe starting with, like, what he's talking about, some of these elder, I don't know, Joseph, that's what I was kind of hearing was these elder, what did you call it? You called it like an association, the elder, the community members, the association, that type of thing.
Right, the community group.
Maybe some of this needs to be directed there, and that would build that foundation then that the nursing home, I just think, in terms of relationships, if you're trying to establish a good relationship so that you are supported in what you do, then maybe some of this kind of root cause needs to be addressed. I may be wrong. I'm just when you were talking, that kind of struck me as kind of a root cause problem.
I think it's just human nature to be fearful of, that, unfortunately, that lifestyle that they've heard about at the nursing home, loss of independence. And I think that if, as we progress through the year, these issues should be raised at all different levels within our community, with our leadership, and within my role as Disability Subcommittee Chair with the National Congress of American Indians, I'd like to bring that there. I collaborate with Mr. James De La Cruz, who's the National Indian Council on Aging president, and I think through our committee and through the various resources we have, we can take this idea and build on it, and not so much scold our people for the way they treat each other, but just remind them of as you say, that continuum, that's just the natural part of aging, and the behaviors that those elders display at the nursing home, at the table, we just have to love them that much more.
Yeah, that's awesome. Thank you for sharing that. I know we're almost out of time. In fact, we are out of time, and I have training to do. So, Hannah, if you could get back to me, I think that would be an awesome topic for maybe to talk a little bit about this, what Joseph was just saying, some things with kind of ages and perceptions and reminding us of the continuum, that we're all on that same continuum, and maybe getting rid of some of the fear. If you could come up with maybe a 15-minute presentation. Is everyone okay if the U of A kind of does a little presentation on our March call? What do you guys think?
I think that'd be fine.
All right. Is anybody not in favor of that? Is anyone opposed to that? Okay, I'm not sure about Blythe. I think she'll be on our call, but we can do both. So, Hannah, just let me know. Our next call is Thursday, March 16th. It's usually the third Thursday. Okay?
Okay.
Okay, sounds good.
All right. Thank you all. Thank you for sharing. Appreciate it.